Hi everyone, welcome to the community classroom. This is Dr. Tracy McCarthy, psychologist, attorney, and educator, and we are continuing our discussion related to Corona and common sense. We are turning our attention to the dynamic of standard of care, and we're going to be paying some attention to the concern related to cross-contamination and cross-infection, and we're going to look at some information related to best practices. And these are best practices for healthcare providers. And these best practices, these standards of care, are for the benefit of the healthcare provider, the patient, and the community. And so we are also going to talk about the need for individuals to seek the highest level of healthcare available. And so that means seeking the highest level of healthcare that is available to you, whether it's public or private. And we're talking about the actual setting there. And we're also going to talk about the dynamic of personal responsibility when it comes to healthcare and taking that onus of responsibility and making sure that no one cares more about a person's health than the person. And so prioritizing that for the individual in terms of demanding that standard of care. And if this video appears on anything other than Dr. Tracy McCarthy, it is stolen and unauthorized. Let's get started. There have been some simulations done related to how to handle pandemics. They've been pretty global in terms of the content that has been covered in the simulations. And one simulation is Event 201. Another one is Clade X. And one thing that they cover is sort of this medical countermeasure dynamic. But it's more global versus local. And by that, what I'm talking about is there's more of a focus on global dynamics and maybe not as much attention paid to those individual patient dynamics. And so we are going to be talking about those individual patient dynamics that were missing in the conversations in these simulations. And so we are going to look at just what individuals should be doing in terms of, again, seeking that highest level of health care available. And these are some of the other simulations that have taken place. And you can look at the videos so that you can get an idea of what they were covering, and you can see the gaps and what perhaps needed to be covered that was not actually covered in those videos. And so you have Clade X and you have Atlantic Storm and Dark Winter, and you can look those up. Plenty of education has been provided related to community spread and preventing that. That would include things like physical distancing and also creating barrier methods. There has been significantly less focus on a very important place and possibility of spread, and that is hospital and healthcare setting spread. And that type of spread is known as nosocomial, coming from the healthcare setting. And so we are going to talk about why it's really important to focus on this, and again, why it's so important to seek the highest level of healthcare available so that this is prevented. Because when nosocomial spread takes place, others are also at risk. So not just the patient is at risk, but the community is at risk when this takes place. And so it's very important, and there should be significantly more education related to this. The main concern that we are going to address in terms of educating about this is the dynamic of cross-infection. And so cross-infection is where harmful microbes, particularly viruses and bacteria, they are spread between people based upon contact with pieces of equipment or actual physical contact between individuals. And so when these cross infections take place, it can create all sorts of complications because an individual may be dealing with multiple microbes. And so it's very important that healthcare professionals seek to create a very clean environment for healthcare provision and also to have very safe equipment. And so we're going to talk about what that looks like and when that might be compromised. And it's generally compromised when people are not seeking the highest level of healthcare available to them. And just for review, these microorganisms can be transmitted a number of ways. It can be through unsterilized medical equipment, someone coughing or sneezing, and so there's been a lot of information about that, actual human contact, or touching contaminated objects. Again, there has been significant information about that. And then also prolonged use of certain types of equipment. And one thing that is important to note is that infection is considered greater, that risk for infection is greater when a person is undergoing a medical procedure. And so the diagnostic testing that is taking place, that is a form of a diagnostic medical procedure. And so that is a space, a context in which cross-infection, cross-contamination may be greater. That risk is going to be greater in those situations versus if you're just sitting down talking with a healthcare professional. And because cross-infection, cross-contamination is such a serious dynamic, it's important that prior to going to a healthcare facility, a medical office, it's important to check it out in advance and even ask about the protocol for making sure that cross-infection, cross-contamination, making sure that those things don't take place. And so it is important to get that information and check out the space ahead of time when possible. Again, this goes back to seeking that highest level of care available. We're going to use a couple of resources to have this conversation, and one resource is coming from the CDC. And so the CDC has plenty of information, educational materials, plenty of information related to infection prevention in outpatient settings and also in hospital settings. And so we are going to just look at a few of the minimal expectations for safe care. And as we go through this discussion, we are going to point out and look at some things that might not be considered the best level of care, that highest level of care that is available. This would be an example of not being a high level of health care. This is not ideal. And so even though there has been this push for getting more testing done, this testing often is conducted in places that are not conducive to the best standard of care. And here you see another example of the physical space not being consistent with a high level of health care, particularly when you consider what is actually available in this particular country. And here again, you see an example of instead of individuals seeking health care in an actual healthcare setting, automobiles becoming the healthcare setting. And automobiles are often not ideal in terms of maintaining the standard of care necessary in order to have the best diagnostic and healthcare outcomes. And again, here you see another location. Again, this is not for the overwhelming majority of people. This is not the highest level of healthcare that is available, even if you look at public settings versus private settings. This is just not optimal. It is not the highest level of care that is available. And it also provides a higher level of risk for many people who may already be at risk for some very negative health outcomes. And again, here you see another depiction of this dynamic that looks very different from a regular healthcare setting. And this is just a depiction of an individual with the personal protective equipment on that individuals would presumably be wearing when engaging in this type of healthcare provision. One thing to consider when individuals are seeking healthcare in these field-like settings is that it's not as readily possible to maintain hygiene and to maintain a safe environment in terms of contamination. And so what should be happening, according to the CDC, is that individuals should be wearing the protective equipment, protecting the hair, protecting the face, protecting the nose and mouth, protecting the clothing. Individuals should not be handling things with gloves on for more than one patient. And so individuals should not be wearing the same pair of gloves for the care of more than one patient. And what happens in these field settings is that individuals may not have the sense that they are actually patients and that they should be receiving the same level of care that they would be receiving in a doctor's office. It's also not acceptable for healthcare providers to simply wash their gloves so that they can reuse those gloves on subsequent patients. Although this type of diagnostic process has become very popular using the thermometer, it needs to be done in a way, again, that is consistent with an adequate standard of care. And so equipment such as this should be cleaned thoroughly prior to touching another patient with it. And so you run the risk when you are in these types of settings of individuals not being as conscious or conscientious about these types of dynamics because you are in a setting that is not particularly conducive to that high level of care. The CDC has also indicated that gowns are to be worn in order to protect both the skin and the clothing during procedures where body fluid contact is anticipated. And so also important is that when the healthcare provider puts on this gown, those healthcare providers are not supposed to wear that same gown for the care of more than one patient. You can see how wearing the same gown, using the same gloves, those sorts of things are going to lead inevitably to cross-contamination, to cross-infection at some point in time. And so this is not a good standard of care. But because of the situation when people are going to these drive-through, walk-through, assembly line types of dynamics, they are at higher than average risk for having a healthcare provider who may not have adequate equipment on site and may not have all of the resources that would be available in a hospital setting or in an office setting. And so it does present a risk, a higher risk, seeking out this type of diagnostic space. And also individuals should be wearing face protection. And so that would include a mask and also a face shield when you're talking about the type of diagnostic testing that is often going on. Now clearly this is what a standard medical facility looks like in terms of a hospital, a larger clinic. And so this particular type of space is going to be able to provide a higher level of care, a higher quality of care, and this is going to be a more controlled space in terms of managing infection and managing issues related to contamination, and also making sure that the individual has access to resources that they might not have in these drive-through, walk-through feel sorts of settings. Something as basic as ready access to soap and water, hot water, right there at the point of care. Now, many individuals may feel as though they do not have ready access to a healthcare space that is of high quality, and they may feel as though they are left with only the drive-through or the walk-up situations. And again, individuals should be seeking out the healthcare spaces that are going to be best for them and that will meet their individual needs. And so again, that goes right back to seeking out that highest level of healthcare available, seeking that out and insisting on that when at all possible. And so again, here you see depictions of people receiving healthcare in their cars. And here you have makeshift facilities. Now, some individuals will say that something is better than nothing. It depends, of course, on what that something might be. And when that something is the environment that you just looked at versus this waiting environment, you can see that, again, this standard of care is going to be different. There will be different expectations. There will be different practices in place when you are in that outside setting versus this more controlled setting. And in contrast, you can see here when the environment is not as controlled, there is a greater risk of contamination and infection. And again, here you can see dynamics where this issue of infection and cross-contamination, this dynamic is higher in these types of situations. And here are additional depictions of this heightened risk. And that is contrasted with, again, this more controlled environment in terms of waiting, in terms of engaging the healthcare providers. So this is a very different environment. Again, here you can see with that assembly line type of dynamic where the risk is much higher. Again, while it may be more convenient in some instances to do the assembly line process, there is still that increased risk in terms of doing procedures like this in this particular type of uncontrolled setting. And these are additional depictions. And here you can see the contrast between those settings and a regular healthcare facility. And of course, there is no dearth of healthcare providers because many of them are being furloughed because they are not being used to provide healthcare at this point in time. And so there are plenty of healthcare providers available. And so individuals, when they can, should seek out, again, that highest level of care that is available. And that highest level of care is going to look like what you see on the screen versus those field settings. And this is just another source coming from the New England Journal of Medicine discussing standards of care related to the nasal swabbing to collect specimens. And so again, there is the discussion of the importance of using approved personal protective equipment in order to minimize the possibility of spreading viruses and bacteria. And again, this is re-emphasizing what the CDC is saying, that the protective equipment should include a gown, gloves, protective mask, face shield. And this entire dynamic is so important that there's a recommendation that the healthcare provider dress and prepare in the presence of another person so that they can make sure that there aren't any breaks or tears, because this then poses a risk of contamination not only to the patient but also to the healthcare provider, who then might spread that to a subsequent patient, other healthcare providers, and others in the community. Again, we have additional depictions of what would be considered less than ideal in terms of a healthcare setting. And here you see information related to the process of putting on the protective equipment. And so putting on the protective gown, washing the hands in between patients, washing the hands thoroughly with soap and water, or using an alcohol-based solution, and then putting on another pair of gloves, also wearing an adequate mask. And so there is, in this situation, the request that individuals use an N95 or higher mask as recommended by the CDC, and then also putting on a face shield to protect both the eyes and the lower part of the face. And as you can imagine, out in those field settings with the assembly line dynamic going on, it's more difficult to control the specimen collection itself. And so again, more risk is created in terms of the possibility of confusion, contamination, and infection. And there is also information related to removing the personal protective equipment. And so the individuals, the healthcare providers, should be removing this personal protective equipment in between patients. And so there's a process for removing the gown, removing the gloves, cleaning the hands in between patients, re-washing the hands when removing the mask and removing the face shield. And again, when out in those settings, those field settings, it's very difficult when seeing one patient right after another to do what is considered the appropriate standard of care. And you are encouraged to educate yourself a little bit more about these standards of care and about what would be best for you in terms of reducing the risk to self and others. Sometimes convenience is not the best thing. Sometimes a little bit of inconvenience is going to be better than convenience in the long run. And again, people should be seeking the highest level of health care available to them. Many people do have insurance, and that insurance would allow them to go to an actual medical facility, and individuals who don't have insurance also would be able to go to public facilities where the standards of care are likely to be a bit higher than what is going on in terms of the field settings. Again, if individuals opt for what is convenient, which would be the field setting sometime with the walkthrough and the drive-through, individuals should just be very conscious of making sure that the risk for cross-contamination is reduced as much as possible. Again, you see this assembly line dynamic going on, and you also see this medical equipment that is out in the open, out in this field parking lot type of setting. And so it is very difficult in this type of setting, in this type of situation, to maintain the cleanliness of this particular type of equipment going from patient to patient. And so we're going to wrap this up now. So we've talked a little bit about cross-contamination and cross-infection. We've talked about best practices and standards of care in terms of safety for self and also for the community. And so safety in terms of the healthcare provider, safety in terms of the patient, safety in terms of the overall community, and the need for many people to seek the highest level of healthcare available. If an individual is already not feeling well, then it is in their best interest usually to seek out the most controlled environment possible with the highest level of care possible. And individuals should be very cautious about putting themselves in situations where they may not have something going in, but because they were in these sort of assembly line situations, put themselves at risk for developing something that they would not have perhaps if they were in a more controlled setting. And again, there are plenty of healthcare providers available right now. And so that should not be an issue. There is plenty of clinical space available, and so that should not be an issue. And so that responsibility is on the individual to make sure that they are receiving and seeking out the highest level of healthcare available. And so those of you who work in settings where you are doing sort of simulations on lower levels, these are some things to think about. And so it's not always the global, sometimes it's the local, and focusing on individual dynamics in terms of patient care, in addition to the larger issues. And again, no one should care about a person more than the person cares about self. Remember, knowledge is power. Take care. See you soon.